finishing up with Chapter 8 with Objective 7, interpret the meaning of abbreviations related to the female reproductive system. Just like in the past chapters, just pay special attention to when letters are capital or when they are lowercase. Also pay attention to spacing. As you can see in the very first one, A and P repair, there is no space in between the and sign. It's capital A and sign, capital P, no spacing. Also with D and C, dilation and curettage, so just pay attention to those things like that. So here we have just a question. What is the abbreviation for inflammation of some or all of the female pelvic organs? Again, just look at your abbreviation list and hopefully you chose PID for pelvic inflammatory disease. And then another question, what is the abbreviation for the ultrasound procedure that uses a transducer placed in the vagina to obtain images of the ovaries, uterus, cervix, uterine tubes, and surrounding structures? Again, look down your list and hopefully you have selected C for TVS, which is a transvaginal sonography. And then let's just finish chapter or objective 8 with applying medical language in clinical context. So here is our scenario. It's also in your book. It's actually going to take us 2 slides on the PowerPoint slides, but it's all in one page in your textbook. So we have the breast is the most common site of cancer in women. More than 80% of breast cancer is infiltrating ductal cancer, which originates in the mammary ducts. The rate of growth depends on hormonal influences. As long as the cancer remains in the duct, it is considered non-invasive and is called ductal carcinoma in situ. Mammography is the most common method used for diagnosing cancer of the breast. Confirmation is done with a biopsy obtained by conventional surgery or guided breast biopsy, such as stereotactic breast biopsy. Treatment may include lumpectomy, mastectomy, chemotherapy, radiation therapy, and hormonal therapy. In many regions of the world, cervical cancer is a leading cause of death in women. Cervical cancer resembles and results from a sexually transmitted disease, a feature that distinguishes it from other cancers. Abnormal vaginal bleeding is the most common symptom. Pap test followed by colposcopy biopsy is used to diagnose this disease. Surgical treatment options are conization, such as the LEAP, and hysterectomy. Chemotherapy and radiation therapy may also be used. A vaccine for human papillomavirus is now available and can be used for the prevention of cervical cancer. Endometrial cancer. Currently, 75% of women diagnosed with endometrial cancer are postmenopausal. Inappropriate bleeding is a warning sign, hence early diagnosis is common. Pelvic examination, pap smear, and endometrial sampling are used to diagnose this disease. Treatment is hysterosalpingo-oophorectomy, which may be followed by chemotherapy and radiation therapy. Laparoscopic assisted vaginal hysterectomy may also be used. Ovarian cancer. Ovarian cancer is the 9th most common form of cancer in women, yet is the most challenging to diagnose and causes more deaths than any other cancer of the female reproductive system. Early symptoms are often absent or associated with other problems, thus early diagnosis is uncommon. Early symptoms include abdominal discomfort and bloating. Later stages include abdominal or pelvic and urinary or menstrual irregularities. CA-125 tests and transvaginal sonography are used in diagnosing this disease. Treatment is total abdominal hysterectomy and bilateral salpingo-oophorectomy, and removal of as much additional involved tissue as possible, including lymph nodes in the pelvic area. Chemotherapy is usually prescribed following surgery. So we have 4 questions. So the first one, which of the following diagnostic tests would the physician use to diagnose ovarian cancer? So again, make sure you're in the ovarian cancer section. Again, if you need to pause it to reread over that paragraph, please do so. But which of the following is a diagnostic test to diagnose ovarian cancer? And so hopefully you are choosing letter B for transvaginal sonography. And then number 2, true or false, surgery is a treatment option for breast, cervical, endometrial, and ovarian cancer. And of course that is all true. Number 3, true or false, excision of the uterus, uterine tubes, and ovaries is an accepted surgical treatment for both endometrial and ovarian cancer. Again, reread the little paragraph if you need to, but that is also true. And now the final question. A vaccine is now available and can be used for prevention of cancer of the blank, and that was of the cervix, letter D, and that is the HPV vaccine that they're talking about. So letter D for cervix is your correct answer. And that will end the recording for Chapter 8. You can now go to eCampus and complete the assignments.